Welcome back, and we are wrapping up this edition of Public Affairs on Peach, and we have been talking about breast cancer. Mia Gaudet from the American Cancer Society is here to share her knowledge, and I want to thank you for coming in. I'm sure you are a wealth of knowledge, but there's so much we hear, what to do, what not to do. Mammograms, let's start there. Should we get them yearly? Should we not get them yearly? If your risk is higher, what should we do?
Well, the American Cancer Society recommends that women between the ages of 40 and 44 consult with their doctor and make a decision about whether to start mammograms at that time. Yeah. But then we also recommend that women between the ages of 45 and 54 do receive annual mammograms, and that women after the age of 55 can then start going every 2 years.
Okay.
But I think, as your guests have shown, that really it's important that at any age, right, male or females, that everyone needs to be their own advocate. And if they feel anything weird, that they should definitely go and see their doctor.
I think everybody should walk around with a shirt that says #listen to your body.
Yes, exactly.
Listen to your body, right? So when you look at decreasing your chance of getting breast cancer and recognizing there is no magic wand, but there are some things we can do.
Exactly. So the American Cancer Society recommends that people try to maintain a healthy weight throughout their life, that they participate in physical activity, and this is a great one that you can do throughout your life and incorporate that with your children and incorporate that into your daily life. Minimize sitting time or sedentary time. So if you're having a meeting at work, that you might have a walking meeting instead of a sitting meeting, and taking the stairs, of course, instead of the elevator. We also recommend that women, if they need to take hormones during the menopausal transition, that they try to really limit the time that they're on them, as well as also limit alcohol intake.
Oh yeah, all of those things. Now, specializing in breast cancer subtypes, what does that mean? And imagining the treatments vary from breast cancer to breast cancer, because it's not a one-size-fits-all.
Right, of course. So at the American Cancer Society, we're doing a lot of research through our extramural grants department, and we have over 100 grants that we have funded in breast cancer, and many of those are really focusing on different treatments for different subtypes of breast cancer, as was discussed earlier. Okay. As well as I do a lot of research in really understanding what might be the different risk factors for different subtypes of breast cancer, so we can really help all women and men lower their risk of breast cancer.
Oh man, that is so great. Now, I know we always hear October's Breast Cancer Awareness Month, and what does that mean? Can you get involved? What can you do? What's the American Cancer Society doing as far as making people, more aware? I mean, I know that there are walks and events. What's going on?
Well, so the American Cancer Society is open 24 hours a day, 7 days a week, 365 days a year. You can always reach us at cancer.org or our 1-800 number, which is 1-800-227-2345. As well as in the Atlanta area, we're having our Making Strides Against Breast Cancer walk on October 29th at Piedmont Park. And I'll be walking with my 2 kids, and I have a little boy, and Real Men Wear Pink, and he will be too.
That's right. You absolutely got to do that. And then the money that's raised, where does that go?
That goes directly to our research and other programs that we have at the American Cancer Society. One thing that I love about working for the American Cancer Society is we really cover the entire spectrum of the cancer continuum, from prevention all the way through helping people navigate through their cancer, as well as help them through survivorship as well.
And here's something else too. I think people have their story and they see other people going through, and you see the shirts. What if I want to volunteer? What can I do?
Right. We welcome volunteers, and the first step would be to go to cancer.org or to call 800-227-2345.
Excellent. Thank you so much, Mia.
Thank you.
Thank you. And thank you for joining us. This has been phenomenal. Absolutely love it. Plenty of opportunities for you to get involved. Thank you for joining us on Public Affairs on Peach. We would love for you to join in on the conversation, or if you have a topic you'd like to see us cover, let us know. Send us an email, publicaffairs@cbs46.com, and be sure to like Public Affairs on Peach on Facebook. Of course, we'll see you back here next week. That's it for this week's edition. That's it.